Today we're going to talk about osteoporosis, and we're going to have an exercise regimen related to the condition. This regimen is also good for improving functional mobility and skill, regardless of where you're at. I dedicate this to my mom, who's an amazing rising star, who always strives for greatness and excellence, and never lets anything stand in her way. Basically, osteoporosis, as you know, affects the density or the tensile strength of your bones. And it can occur anywhere in the body, and it can also occur at any age. That's why women over the age of 30 are often told to increase their calcium supplements and also to see a doctor. Because at any time, we don't know what changes our bodies are going to undergo. But the point is, regardless of what your age is, once you're medically cleared by a doctor, an exercise regimen is very good for maintaining your functional mobility, your strength, your skill, your posture, and your overall well-being. Today we're going to start out using a nice piece of material, exercise tubing. Now for those of you who don't have any, it can often be bought very cheaply at a surgical supply store. I think it's about 88 cents a yard. But for those of you who can pay a few more dollars, then you could always get this lovely tubing at a Walmart or a Marshall's or even a Modell. I think it's a package of 3 for $10. This one is blue, so it's like a medium strength. We're going to tie it around the upper part of our legs. This is good for strengthening our outer thighs or our hip abductors, which are necessary for maintaining balance and coordination and stability at the ankle. Let's begin. We're going to do a set of 10. Once it's properly tied in place, you move the legs apart. Let's hold for a count of 5, 4, 3, 2, 1. Then we will close. Open again. 2, 2, 3, 4, 5. Close. 3, 2, 3, 4, 5. Close. 4, 2, 3, 4, 5. Close. 5, 2, 3, 4, 5. 6, 2, 3, 4, 5. 7, 2, 3, 4, 5. 8, 2, 3, 4, 5. 9, 2, 3, 4, 5. 10, 2, 3, 4, 5. It's often good to do 3 sets of 10, but for demonstration purposes, I will only be showing 1 set. This, by the way, could also be done without the tubing in case you're right now too weak and just starting out. Or even by putting your hands against the sides of your legs, you could also engage it, manually grading your resistance to your tolerance. The next exercise can be done with or without a weight. For those of you who like weights, you could begin with a nice, gentle 1-pound weight that could fit snugly around your ankle. And again, these can be very inexpensively obtained, even at your local drugstore or pharmacy, whichever term you prefer to use. And we're going to strengthen our quadriceps muscle, which is basically a postural muscle or anti-gravity muscle. So we're going to begin. We're going to extend the right leg. Hold it for a count of 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Lower the leg. We're going to do a set of 10 of these on each leg, and then afterwards we'll commence with the next one. And again, I suppose you like the count. 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Getting halfway there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. A little bit more to go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. We're going to switch legs. Again, this is a form of a weight-bearing exercise, which is good for building up your bone density. It's also good for toning and strength, which you're going to need to maintain your functional mobility, because as we age, strength decreases, unfortunately, from the bottom all the way upward. That's why it's very important to maintain your strength, your balance, and your coordination. Now, beginning with the left leg. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now, of course, this muscle works in 3 directions. For now, I've shown you one straight plane. For those of you who have not had hip replacements, or if you have, you've been medically cleared and your precautions are no longer in place, then the same movements would be done with the foot turned out towards the right when you extend it, which would get the outer component of that muscle. And then, of course, it could be done for a set of 10 with the foot turned inward. So that would get basically the internal part of that muscle, because the muscle works in a few directions, so you can engage all components. If not, if you cannot do the side to side, then you just simply stick with the straight plane. Now, the next one we can do are some basic lifts, marching up and down. 3, 4. Again, assuming you're medically cleared, or if you've had a hip replacement, then you know you have to skip this one. It would violate your precautions. But if you're medically cleared and you have no hip precautions, this one is safe to do as well. 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, as far as the upper body goes, we can again use our lovely exercise tubing. What you're going to do is you're going to wrap one end around your left hand. The other one you're going to hold a little bit in your right hand. And we're going to pull up and out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we could also go to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then a downward component. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, I'm only showing one set for demonstration purposes, but you should gradually try to work up to 3 sets of 10. It's ideal. Now let's make it symmetrical and do the other side. Wrapping the material now around your right hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now mind you, if you don't have any of these materials, that exercise can simply be done by simply moving the arm. You do not need this component, but the resistance is valuable because again it will help build bone density. Let's reach up and across. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then reaching downward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we can put this aside. Assuming you're functioning in normal circumstances, yes, this can help you. We always have exceptions to the rules. So if your bone density doesn't improve, at least functional mobility and balance might. Now using our chair, standing facing our chair, we'll keep our feet together. And we're going to go up on our toes and down. This is good for strengthening. This is good for balance. 3, 4, 5, 6, 7, 8, 9, 10. The next one is called a quarter squat, because you're going to come down a little bit with your knees, just a small movement, and then up, not a large one. 2, 3, 4, 5, 6, 7, 8, 9, 10. The next one will involve the outer thigh again. What you're going to do, for visual purposes, I'm going to face you, but you can also stand at the side facing your chair. If you don't have enough balance, you can hold on. If not, you don't need to. This can be done again with and without weights. Starting with the right leg, we're going to lift and lower. 2, 3, 4, 5, 6, 7, 8, 9, 10. And then this could be done to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Afterwards, we will do a lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, this could be done with holding on or without holding on. Now the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And these are some nice exercises to start off with. Again, there's no substitute for going to a doctor. You should always obtain medical clearance before doing any regimen. I feel this would be a nice adjunct to your normal routine. So, once medically clear, doing these exercises every day are not only beneficial to people with osteoporosis, but anyone who just wants a nice beginning to lay a foundation for improving strength, functional mobility, and of course their quality of life. These exercises are also good for improving balance, which is needed, especially as we get older, because we're at higher risk for falls as our muscle strength changes. So therefore, this is a nice regimen that I feel can help everyone. Try a little bit each day. Maybe you'll be able to complete it all in one sitting, but eventually you should be able to complete it all. Start out with as many reps as you can. working up to your first set of 10, eventually to 3 sets of 10 of each one. Keep moving forward. Keep building up and keep going. Continue to rise. Thank you for your time. I look forward to seeing you guys again.